Modafinil is a drug that has the molecular formula C15H15NO2S, 2-diphenylmethylsulfonyl acetamide, and is classed as a wakeful-promoting agent. Modafinil has structure similar to amphetamine with its distinctive aromatic ring structure. It is an oral tablet usually given at a 200 mg dose for the treatment of narcolepsy. Modafinil's medical uses include the treatment of narcolepsy. It is also used in drug addiction treatment. And although not FDA approved, it has also been used to treat ADHD, increasing energy, productivity, alertness, cognition, and focus. So how does modafinil work? Well, researchers haven't located a single site of action. However, it is proposed that modafinil stimulates histamine, noradrenaline, serotonin, and dopamine receptors. It also activates orexin systems in the brain and decreases cortical GABA activity via the norepinephrine pathway. Modafinil also acts by increasing glutamate activity. Metabolism of modafinil occurs in the liver, with metabolites being excreted by the kidneys through the process of hydrolytic deamination. Modafinil has a half-life of 15 hours and a peak plasma concentration occurring at 2 to 4 hours. Modafinil treats narcolepsy. Patients are diagnosed with this sleep disorder using the DSM-IV criteria of narcolepsy. This criteria contains 3 specific characteristics and includes recurrent daytime lapses of sleep occurring over a period of 3 months, coupled with sudden bilateral loss of postural muscle tone. Excessive sleepiness, with associated features of sleep paralysis, hallucinations, and disrupted major sleep episodes are characteristics of narcolepsy. Undertaking a multiple sleep latency test will demonstrate 2 or more REM episodes in narcoleptic patients, taking into account no underlying psychiatric disorders are present. Modafinil treats narcolepsy as it has been shown to promote wakefulness by increasing dopaminergic neurotransmission, therefore affecting hypothalamic structures involved in homeostatic and circadian regulation of vigilance. Modafinil was approved by the FDA for the treatment of narcolepsy in 2003 and was shown to decrease theta waves and increase alpha waves during wakefulness and increase theta activity during sleep. Modafinil can also be used to treat those suffering from substance abuse and addiction, particularly in regards to cocaine and methamphetamines. Although the mode of action of modafinil remains unclear, studies reveal that its stimulating and agonistic effects have the ability to decrease withdrawal severity amongst abusers. In relation to targeting substance abuse, modafinil acts via different neurotransmitter systems, increasing dopamine, glutamate, norepinephrine, histamine, orexin, and decreasing GABA levels. Studies reveal that dopamine and glutamate enhancing actions particularly have the greatest effect in decreasing withdrawal severity caused by neuroadaptation to drugs. Modafinil binds to dopamine receptors and thus increases dopamine levels within the nucleus accumbens, triggering the reward pathway. An increase in glutamate levels, particularly in the nucleus accumbens core, is associated with regulating the habit of cocaine seeking by the stimulation of group 2 metabotropic glutamate receptors. Trials reveal that modafinil administered daily at a dose of 200 mg is effective in decreasing cocaine cravings amongst abusers. The potential abuse liability of modafinil is very low, with reports of abuse being rare. This can be explained by its chemical properties such as its poor water solubility and its limited routes of administration. Being given only orally, cannot be smoked or injected. With this, its duration of time and its bioavailability account for its low abuse liability. There are many side effects of modafinil such as anaphylaxis and hypersensitivity, with the most severe being Stevens-Johnson syndrome, a life-threatening rash. This rash presents with flu-like symptoms before progressing into painful red-purple blisters, effectively killing off the top layer of skin. Other side effects of this drug include depression, rhinitis, chills, headaches and dizziness, heart problems including hypertension and hypotension as well as chest pain, lung problems, upset stomach, decreased appetite and nausea, and mania, delusions and anxiety. We hope you now know more about modafinil and its uses.